Hi everyone, my name is Dr. Indra. It's so lovely to see you all here this evening and joining us for this webinar by our wonderful pharmacist, Bobby. And what we would like to do is I'll just do a little bit of an introduction. This webinar has obviously been recorded and we would need your permission for us to share this. So you've obviously all pressed record here. If you have any problems with the webinar being shared or any problems like that, please let me know and we can always make sure you're muted and your video is shut down. I'm going to tell you a little bit about our team. Okay. So just a little bit of housekeeping before we start. Make sure that you mute your sound. You can keep your video on if you want to, but otherwise, you can down your video if you need to. And also, please feel free to type out any questions that you want to ask. If you do not want your name or anything to be mentioned, you can directly message myself, Indra, or or Ellie, who's here as well, is part of our team as well, Ellie Hughes. And also, we do appreciate that we can't answer sort of specific medical questions, but just we can answer generalized ways in how we deal with our patients. Just for your information, obviously this is not providing medical advice, so please make sure of anything that we say here that you speak to a practitioner or to your team before you make any decisions or think about any changes that you want to make. So we are a multidisciplinary collaborative care team. I started in nearly 8 years ago on my own, and we've grown into this wonderfully passionate group of doctors and pharmacists and psychotherapists, and we have a wonderful admin team as well. Together, we support patients from all sorts of backgrounds. And our main focus has been over the last few years is kind of endocrine, hormone, menopause, and mental health. We have our consultant psychiatrist and our consultant endocrinologist within our team today. Will the members of our team just give a shout out before I introduce Bobby? Ruth, do you want to just quickly say hi and what you do in our team?
Hello, everyone. I am the integrative psychotherapist on the team, so I look after people's mental health and well-being. Oof, frog in my throat.
Ellie.
Hi, I'm Ellie. So I'm the patient administrator and care coordinator. Please feel free to send me any messages. I've put our email address in the chat below.
Thank you. And I think Avril as well.
Hello, everyone. I'm Avril Bunton-Williams. I'm Business Support and Operations Manager. Thank you all for joining us today and hope you enjoy the webinar.
Thank you so much, Avril. Corey, I think you're here as well.
Hi, everyone. I'm the nutritional therapist at the Dr. Indra Clinic. So I look at food, basically, everything you're eating, but also around habits around food, how we can make those kind of changes, to support your health and well-being.
Thank you so much, Corey. So, functional medicine. I'm sure most of you sitting here might have an idea of what functional medicine is. But to us, this is why we have a collaborative care team. Functional medicine is about getting to the root cause and understanding why your body is feeling the way it's feeling at this moment in time. We have the biological aspect, the nutrition, the mindset, the lifestyle, and each member of our team focuses on one aspect of this. So together, we can see the whole of you when we are supporting you as a human being in our practice. One of the key principles of functional medicine, which I forgot when I was doing conventional medicine, is this. We have innate health within us. That is a statement which I always start all our webinars with. I want people to just sit and see whether that resonates within them. You are whole, you're not broken. So these are the core principles that we're working with within a functional medicine capacity. We have healing capacity. We have genetic uniqueness within all of us. We're looking at inflammation as the root of a lot of our chronic illnesses. We use a very scientific look at how it's working. And we actually look at vitality rather than disease. Right, so today's webinar is about prescription drugs and nutrients. I'm going to hand you over to Bobby, who is going to introduce himself and take it away, Bobby.
Hello, everybody. I'm just going to get my screen sharing so that I can then start for you. So a few clicks and I shall be there. So just so hopefully you can see my screen okay and the slides. So there we are, the hidden impact prescription drugs and nutrient loss. But really, first, a little bit about me. I'm Bobby and I'm a pharmacist. I call myself an integrative pharmacist because, as Indra says, we look at everybody as a whole. And I love it when I hear Indra say that you are whole, not broken. And that's so important. And in fact, that gives me kind of goosebumps when I hear it, because it's so important. And having spent the day, you know, in an NHS trust working, I've just seen a lot of sort of brokenness. And then to come here and to see this wholeness, it's just exhilarating to me, to be honest. So it is with great passion that I feel I can call myself an integrative pharmacist. I'm also an Ayurvedic practitioner, a yoga therapist, and with those together, I've really learned to take this very, very wide and full perspective of how a human being is and how important they are from their mind, body, health, emotional, mental, and spiritual. And I think that's really, really key. And although today we are looking at medications, I'm looking at it from this perspective of how they interact with natural processes in the body, how we might absorb, produce, or use the nutrients that are the vitality that we want to have, and the vitality that sometimes feels like, you know, has it left us? Sorry, Indra, is the screen actually sharing as a slideshow or not?
No, I was just going to stop you there. No, it's gone back to the other one. The sort of
Apologies, I thought so. There we go. So my apologies for that break. So there we are. So that's me. And I think this picture that came up, this sort of behind the title, resonated with me as well. And it just made me think, you know, to share with you that you need to think of the body as a river with all these interconnected streams that allow this healthy, vital flow. And any disruption in any one part of a river will affect the entire ecosystem. So disturbances or ripples that might be caused by a medication, they will actually travel and ripple through all the biochemical pathways in the body. And I want us to be empowered to understand what we could do in terms of finding solutions around that. So although we need to be aware of the types of drugs that can rob our bodies of the very nutrients that give us this vitality and resilience and joy of living, my aim today is really to arm you with the knowledge so you can find solutions that balance the immediate benefit with prevention of long-term consequences that some drugs unfortunately do give us. So moving on, the most important thing to me is finding that balance. Now, at some point in our lives, we all will, or do already, find ourselves needing medications, whether it's a prescription drug or something we just buy over the counter. And these medications are crucial in many times. They can save lives during a short-term crisis. For example, a potent antibiotic that's fighting off a dangerous infection, you need it. Swiftly lowering a really dangerously high blood pressure. Let's take that medicine. Keeping your blood sugar levels in check. So key to our metabolic health. So there are consequences of not treating certain conditions, and they can be severe too. So medicines are important. And today we've got access to this huge variety of drugs that have undergone rigorous safety trials. They're closely monitored for any new side effects and any other problems. Yet, despite this rigorous testing, the very micronutrients that sustain life may be compromised. So to me, it's finding this lovely balance, the drugs and the nutrients, what saves and protects to what sustains and maintains. And that's really how we're going to look at it today. It's not about stopping the medicines, this is about supporting the body. So with these medicines, what we find is there's a bit of a hidden danger lurking beneath the surface. And that is this potential for some long-term use to induce deficiencies in essential micronutrients. Now, these don't just happen overnight. They could happen over weeks, months, or even years. Quite often get left unnoticed or result in another disease condition. So before I carry on, a little anecdote from me, a personal anecdote. So when I graduated, there I am, happy face, a little bit of, well, it looks like I've got rouge on my cheeks there, but I promise you it's not. Graduated and completed my training as a pharmacist 27 years ago. So obviously I left smiling just like that with my scroll, armed with the knowledge that I was going to help people. And I made my commitment to put patient welfare first. That's the code of ethics as a registered pharmacist in the United Kingdom. So off I went, and I did that, or I thought I was doing that, until I suddenly realized that, well, I've learned loads of things about drugs, absolutely brilliant stuff here, and I am feeling really knowledgeable. When I look back now, there was little to no emphasis on micronutrients and what might happen to them by the drugs I'm taking. I could tell you every little pathway and every little receptor the drug might go to and what every little side effect it might do. I could predict the side effect you were going to get, and I could tell you what it will take to stop that side effect. And actually, so I was helping you stay on this sort of merry-go-round. I call it the merry-go-round. But somehow I was still unaware of what the drugs were doing to our nutrients. So sadly, this lack of awareness extends beyond my experience. And so there are many healthcare providers unfamiliar with these deficiencies and excesses with our micronutrients. That's because it doesn't really appear on our curriculum. So I do truly believe that the problem with this oversight is nothing less than catastrophic to our well-being. Why do I think that? A deficiency could easily be wrongly attributed to a new disease, which means a new diagnosis, which generally adds another medicine to your ever-increasing list of prescription medicines. Sometimes the deficiency is just put down to good old natural aging process. There's always a good excuse for anything. But actually, we may not be aging as well, we may be aging much faster. But all of this is potentially delaying correct diagnosis and treatment. So I think it's okay for me to say that I've identified a gap in our knowledge. I identified the gap in my knowledge and tried to change that. But I think there's a broader picture, and this is where, I think we can put it right and, hopefully stop the likelihood of serious consequences for people in their health and well-being. So we are blessed with what I call the magnificent system, which is our body. It's this interconnected, beautiful, beautiful system. And I mean, to be honest, I get overwhelmed by it when I think about it. To me, it's like looking up to the cosmos. Everything you see is just so vast. And that's exactly what's happening inside of us. This beautiful system inside of us. And that's how I want us to see ourselves and everything going on inside of us. Drug-induced micronutrient depletion can often be the root of other unexplained symptoms. And some of those can actually affect you taking a medicine. So today, it's about demystifying this rarely addressed situation with some of the most common drugs that we are prescribed. So by no means can I go through them all, but some of the common ones. And the truth of the matter is, research in this area is always limited because there is nothing to be patented. There is nobody to fund a bit of research into a nutrient that's widely available at any health food store. So it's hard to find the research, but thankfully there is enough to put enough backing to some of the things that I'm going to be telling you today. But remember, it's all about finding the right balance. And we don't want to forget that throughout this entire webinar. So I want to raise your awareness because I want you to feel empowered to have the conversation, be it with your doctor, your pharmacist, or other healthcare professional, because I want you to act before it's too late. Because there's so much that you can do for yourself and not wait for something else to come up. So in today, key points I think we've already kind of established. Medicines are potentially life-saving, but nutrients are vital to life. And then as what will follow from that really is, well, should I be taking supplements or should I not be? Now, I'm going to say right from the outset, to me, the diet is probably the most important, and I know Corey would agree with that. So that is the foundation for everything. But there will be situations that when you've been on something long term, there will be situations where we may need some help. So let's be informed and sensible. And it's really crucial that we are informed and sensible. And I am definitely not advocating for indiscriminate supplement use to prevent potential deficiencies. It's about taking them at the right time, for the right person, and at the right dose. And monitoring and testing can help us with that. It can help us identify imbalances and routes to rebalance. So for me, it's test, don't guess as well. Unless I can see, the variety of drugs you're on, and it's going to be almost fairly obvious that they are all contributing to this 1 or 2 or 3 nutrient deficiencies, then we could probably go ahead and do something about that straight away. But remember, awareness leads to empowerment. And it's that empowerment which drives the action. And when you've got a collaborative approach, where you've got people that are going to look after you in a multidisciplinary healthcare team, it is working together that you receive the best results possible for a tailored care for you and your individual needs. And again, that's so important. And I think, the joy of working for this practice is that personalized care. So, micronutrients. So our magnificent system. It's got to start with some structure. It's got to start with a solid foundation. But that solid foundation has decided to disappear from us for a minute. So let's bring it back. I'm getting a bit click happy. See, this is what happens when I get overexcited. It's just my nutrients working very hard. Okay. So just as a building structure requires the right materials like concrete, nails, and wood to form its foundation, the human body also needs essential building blocks. And for the purpose of today, those essential building blocks are going to be our carbohydrates, proteins, and healthy fats. That's our foundation. And without these foundational elements, the body cannot really do very much. It can't make its new cells, tissues, or provide the energy that every cell needs so you can do the things that you love to do, so that I can keep clicking the mouse. Yeah, so we need that energy. But the foundation is not enough either. On top of the foundation, it requires the proper materials and tools to build the tower of life upon. And this is where those micronutrients come in. The vitamins, the minerals, the cofactors, they all come into play. They act as essential components to support thousands of physiological functions, perhaps millions, from enzyme reactions to complex immune system regulation. This is a delicate balance, and sometimes drugs disrupt it. Actually, let's be honest, a lot of the time, drugs disrupt it by altering the body's ability to do some things with these vital nutrients that are needed for all of these functions. So, again, it's always the thing that concerns me most is that when that happens, I don't want you to be diagnosed with a new disease, which might just be a deficiency. I want us to know where we are. So this notion of another drug being added on, which I will call the medication merry-go-round, and I may say it many times today, is what I don't want you on. I want you to come off that. There are way more fun rides to go on than a merry-go-round. So if I move on and just have a quick look at what drug-nutrient interactions are. I think I said earlier that, drugs are absolutely vital sometimes, but nutrient deficiencies that they may cause can remain hidden for months or years. impacting your quality of life. So you're on the drug because you're not very well, so already your quality of life is down. And over time, we're kind of reducing that quality of life if it's depleting you and we're not addressing it. So I don't want that to happen to you. And I think estimates have been that more than half of the drugs that are approved in the US, which is probably the same as in this country, commonly unknown to deplete specific nutrients, creating this hunger inside that beautiful cosmos that is you. But there's still not enough data, but there is enough to create half the drugs around us can do this to us. Now, how are drugs doing this? There's a variety of ways that this happens. And so drugs can alter the way the body absorbs nutrients. They can alter how we digest them, how we might transport them around the body, how we might transform them from nutrients into really usable substances that can follow the pathways that give us the cellular energy we need down. They can sometimes even just stop the breakdown of them in the right way. And probably even more severely, they can stop us from eliminating the toxic breakdowns of drugs. So we get a backup of them. So we're stimulating and inhibiting different pathways in the body. We're also sometimes damaging that beautiful microbiome, that intestinal flora. And often we're doing this by chelating things, by grabbing the nutrient and taking it out the GI tract, depriving cells of it, or altering the acidity so we can't actually do anything with that great big molecule of calcium that's just come in because we can't break it down. So it's also, you know, that's what the drugs do, but it's also important to know that this is a bi-directional thing. So the nutrients can also sometimes mess around with your drug. So it's really important to know that as well. So you may not sometimes get the most benefit from your drug because of something else that's working in the body. Grapefruit juice is probably the most common one. It has so many interactions with drugs, either increasing the metabolism of the drug, so the effect's not great, or actually slowing it down so you get higher doses than you actually need. So that's looking at it simply. But drugs can interfere with the drug too. Nutrients can interfere with the drug too. And then there's other risk factors. There's people factors. And how often do we actually, I've gone click happy again, and how often are we actually reviewing drugs? Polypharmacy, this is a big thing. Polypharmacy basically is more than one drug that you're taking, which is a lot. So at that point, how often are you reviewed, or do you just keep having them? To me, it's always an alert button, and it's really important those medications are reviewed, and we look at it from a stop-start perspective. You know, as a collaborative team working alongside your doctor or GP as well, because it's really important that everybody is involved in your good care. But there are other effects. So we have the nutrients that could affect the drug could affect the nutrients, but there are also other things, patient-related things, age, sex, diet, metabolic status, stress, how you take the medicine. Do you take it with water, or do you take it with tea or coffee, or do you just swallow it with nothing? I mean, genetics as well, lots of things. And then the drug-related problems that can ensue is, you know, is it the right route for you? Your stomach doesn't digest, so should we give you something that's more like an intravenous injection, or should it be sublingual where it absorbs through the mouth or applied to the skin? What are the right things for you? And then we've got things about the micronutrient too. How does that move around? What are its chemical properties in the body? What's its dynamic movement in the body? And how does it excrete from the body or build up in the body? So it's a whole big picture. And that's why it's this magnificent interconnected system. It's big. But when we are, you know, this is occurring and the body is being starved of some of these nutrients, I call it this hidden hunger. And that's that little cosmos looking a little bit sad. This brain of ours. If we knew ourselves were feeling this way, we would really want to take care of them, to quench that hunger and revitalize them. So from the building analogy that I gave you earlier with the foundation that helped us understand about the structure, I want to just talk about this inner terrain that I call the soil of your body. Now, the quality of the soil depends on the quality of the seed that blooms. Because I like to garden, I was looking at some soil magazine, believe it or not, the Daily Digest of Soil, and I found these three wonderful qualities that literally just reminded me of the human body. And it was, what does good soil require? First thing, this healthy inner terrain, what our soil requires, is optimum nutrient availability. The second thing, it needs good biodiversity. The third thing is a balanced structure, higher levels of organic content. But those three things are actually written about soil. They are no different to that inner terrain of ours. And actually, I really love that, because we need that optimum nutrient availability for everything to happen. That biodiversity, we are in the age of understanding the microbiome well more than we have ever done before. And there is so much that we are learning about it. And we know what this structure needs to look like and feel like as well. So optimizing these micronutrients is really key to our health and vitality. So this hidden hunger, as I call it, it underscores the significance of micronutrients for health. What are these micronutrients? Vitamins, the fat-soluble vitamins A, E, D, K, all the water-soluble vitamins, all the B's and the C, minerals, calciums, magnesiums, calcium, trace elements, and other minerals, iron, copper, zinc. Then other things, cofactors like coenzyme Q10 and glutathione. This list is non-exhaustive, but focusing on these categories today provides a foundational understanding of the critical role they're going to play in supporting your health and longevity. Now, I'm just going to share a common story, and this is a common story I've heard so much over the years working as a pharmacist. I eat a predominantly plant-based diet. I exercise regularly. I've actually never smoked, and I drink very little alcohol. I just don't really like it. I take my tablets diligently, and I work really hard at relaxing. I just feel tired most of the time. My energy level seems to have gone down. My muscles get achy and crampy. I used to sleep well, but now I just keep waking up, and some days I just feel low. I just don't know what I'm doing wrong, because I'm trying so hard. So on paper, this all looks like he's doing all the right things, but something is going wrong. And I'm going to unpick this. We're going to come back to this, but I'm going to make it make more sense first by just having a whistle-top tour through some of those micronutrients. So firstly, soluble vitamins, the B vitamins. Now, B vitamins are involved in a gazillion biochemical processes in the body, from head to toe. Literally, if you have exhausted your body of B vitamins, you can start to feel really bad and quite quickly. But they are so essential in maintaining optimal health and well-being. They've got overlapping roles, as you can see from this table, and you really don't need to read all of it, but all of those Bs, these overlapping roles in energy metabolism, in red blood cell formation, in cardiovascular health, in nervous system function, DNA synthesis, immune function, mood regulation. Now, if these all start to deplete, what you might notice is feeling low, depressed, poor memory, muscle pain, spasms, weakness, stiffness in muscles and joints. You might feel more sort of nerve tingling, burning sensations, numbness, maybe more headaches, fatigue, nausea. Believe it or not, these are just a few of the symptoms that can result from a serious B deficiency. Now, certain people and populations are more prone to B deficiencies. So the elderly, vegetarians, vegans, those with GI disorders, very poor diets, ultra-processed diets, alcoholics. I mean, alcohol is probably the biggest drug thief for thiamine, vitamin B1. But the depletion of B vitamins by medications is actually the most common ones being antacids. I'm going to look at those in a minute with you. The other sort of things that can do this, one great example that comes to mind is furosemide, which is a loop diuretic, and we use it in congestive heart failure. And I think there was a study done and on people that were on 80 milligrams of this drug to help them with their congestive heart failure, and they found thiamine deficiency in 98% of those patients. And that was pretty severe. But oddly, that particular vitamin is beneficial in heart failure because it can naturally help normalize cholesterol, which you want in heart failure, and it's mildly diuretic itself, which again is very beneficial in heart failure. So the very drug that is treating it is actually causing a depletion that could actually help it. And this is where the merry-go-round comes in. So this is why these things get so interesting when you start to break them down. But let's have a look at these in a bit more detail, I think. I picked my top 3 hunger inducers, that little body feeling hungry, those cells feeling hungry. And I think number 1 is the acid-reducing drugs, what we call the proton pump inhibitors. I'm sure most of us have heard of them, things like omeprazole, lansoprazole, pantoprazole, a variety of them. And we have these H2 blockers, histamine, like motidine and cinnamon. So all of these are going to impact how you absorb nutrients because we're changing the environment, we're changing the acid content. And the acid is important for so many things. So there was a brilliant review article on proton pump inhibitors and the risk of vitamin and mineral deficiency. And the clinical implications were that there was mass decreased absorption of vitamin B12 with prolonged use of these drugs. Because the gastric acid is really needed for releasing the B12 from the food proteins, so it can be available for absorption lower down in the small intestine. So they're also going to interfere with other B vitamins such as folate and riboflavin, all really important for all the physiological things we just discussed. It's also the calciums, magnesiums, the other things, but we'll look at them again later. Number 2 is the anti-diabetic metformin, which is obviously life-saving for many people, helps you keep your blood sugar under control as a type 2 diabetic. But again, no, B12 absorption is decreased. Now, I found a lovely article that said that we knew this since the 1960s, and yet we have not made B12 monitoring a necessary component of metformin therapy. I find that really quite interesting. So another drug that is reducing one of these very important B vitamins. The last one I've got on this list is estrogens, oral contraceptive pills, and HRT. And both of these can cause a decline in B vitamins. And in fact, in all of them, and there's also information about the specific B vitamins and the effect that can have on them. But as a general overview, if you think about the oral contraceptive pills and HRT, weight gain can occur with them, and this is often contributed by a slowing metabolism, which could be linked to low B vitamins since they help with that metabolism. The B vitamins also nourish your nerves and help form myelin around nerve cells. And that depletion may make your nerves a little bit more touchy, pins and needly, more likely to develop things like carpal tunnel syndrome. Studies have shown that B6, the pyridoxine supplements, in the right dose and in diet, can help patients. The lower the Bs, also the higher your levels of inflammation-causing chemicals in the body, homocysteine and C-reactive protein and interleukins. They get too high, you have an increased risk of heart attack or stroke. The low B vitamins also increase the risk of depression. The Bs, they make feel-good chemicals. That's why they call them the Bs, because they buzz around and they make you feel good with the dopamine and the norepinephrine and the serotonin. But if you're on long-term contraceptive pills and HRT, sometimes that can be reduced. And we might wonder what might be driving the anxiety, the irritability, the tearfulness, depression, the adrenal exhaustion, panic attacks. So here we just think Bs, because all of these are having a bit of an impact. B12 so commonly, all the B vitamins, but also magnesium, zinc. The microbiome is also affected. They're all going down, as is vitamin. When we give these drugs, antacids, NSAIDs, antibiotics, some anti-seizure tablets too, what are we doing? we're increasing the likelihood of heart disease, high homocysteine, fatigue, IBS, high blood pressure, anemia, infections like candida, depression, lower immunity, and nerve pain. But if we understood what was happening, we could actually do something so that we could get the benefit of the drug and also stop any of these things developing so we don't get on the merry-go-round. It's all about not getting on the merry-go-round. And these are the solutions. These are the solutions. It's never about stop the meds. It's about support the body. And once we've supported the body and got you in a good place, then we're in a good place to talk about reducing or deprescribing. But first, you support the body. The fat-soluble vitamins, the A, D, E, and K. So we know how important these are for vision, immune function, calcium absorption, mood regulation, bone health, antioxidant, protecting cell membrane from damage, blood clotting, bone metabolism, cardiovascular health. So because these are fat soluble, those drugs that affect these are really things like the mineral oil laxatives, because they will push things through very quickly and drag all the fat soluble vitamins along with them. Cholecystiramine, which is a bile sequestrant, can also be used with high lipids in the body. That can also take out these lipid soluble vitamins. Certain antibiotics as well can do the same, like rifampicin, and some anticonvulsants too, like phenobarbital. I think phenytoin too. So there's a lot that's going on here, but the number of drugs doing it is less and probably less commonly. The body is able to store these vitamins for much longer too. But I think vitamin D is probably, the one that comes up. Oh, the other drug that can affect this right here is serotonin as well. So serotonin can reduce D, which is always quite interesting because D is our sunshine chemical, makes us feel good. Serotonin reuptake inhibitor like Prozac or one of those popular ones, fluoxetine, they can actually help that go down, which isn't going to help you feel great either. So there's this knock-on effect of so many things happening. And I think vitamin D, it's converted to that powerful hormone. It's like a steroid, calcitriol by the liver, kidneys, and can target more than 2,000 genes in the body. So it's so vital. Hence why it's become sort of the darling of supplements, vitamin D, and rightly so. But we want to know what we're taking it and how we're taking it and for how long as well. So what I find quite interesting again here with vitamin D is generally the levels that we recommend in this country. If we're looking at the readings on it, I'll just put some arbitrary numbers out there, but if it's 30, it's because you're going to have good bone health. But we're not looking at what's the level you need if you've got colorectal cancer or breast cancer. What's the level you should have if you're a diabetic? Is it the same as somebody who can be 2 or 3 or 4 times more than what that actual cutoff is that we look at to say that actually you need some vitamin D? So our cutoffs sometimes are quite low from the point that we will start actually treating. So this obviously could do with a lot more research and a lot more public knowledge as well as to what we need in a dose. But to be guided by a healthcare professional is the best way for this. And vitamin D, it's so important because it's a cofactor for everything as well. So if you think anything that blocks magnesium as well, but also zinc, vitamin K and A2, that will also have an impact on your D. So PPIs, again, are going to affect this. Those were those proton pump inhibitors, those omeprazole and lansoprazole. And now the interesting thing is metformin reduces magnesium, and we want magnesium for vitamin D to help it improve insulin sensitivity. But metformin, as you remember, is an anti-diabetic, and yet our magnesium is going down. Without that magnesium, we're kind of losing a little bit of that endogenous help we get for insulin sensitivity. So a knock-on effect of the drug is to treat the condition, is to not help the body help itself. So again, how do we balance that? Take the right supplement at the right dose. Okay, I'm going to move on because time is flying, and we'll have a quick look at the trace elements very quickly. So calcium, iron, magnesium, zinc, iodine, potassium, sodium. Now, I've just listed a few of the drugs there that are going to impact them. But as you can see, the PPIs come up quite a few times again. So, you know, things that are blocking our acid, that first port of call for everything that we're putting into our system, are probably having the biggest effect on that entire interconnected system. So something I think we should all be really, really aware of. And antibiotics, particularly things like the quinolone, so the common names would be something like ciprofloxacin. You know, they chelate or they grab things like magnesium and calcium and zinc. They reduce the amount in the body. And so if you're on these long term, you really need to be talking to someone. And there are reasons you might need to be on it long term, but we need to balance it again. And again, metformin will reduce your calcium, maybe your magnesium a bit more, and all the other drugs listed there. I think corticosteroids, which haven't come up yet, things like prednisolone, hydrocortisone, these are things that, again, will have pretty much an impact on most of these things, pretty much all the minerals, as well as some of the B and C vitamins. So we want to be careful there. But things like iron and calcium, you know, thyroid medicines may have an impact on, but conversely, these minerals will also affect the absorption of that medicine. And you know how important it is if you need thyroxine. So you need to be careful on timing of doses and what dose you're taking. And then the next place I'm going to take you on a whistle-top tour is coenzyme Q10, which I'm sure most of us have heard of. Powerful antioxidant. It makes energy for you by sparking the production of ATP that every cell in your body needs in order to function. It's a bit of a slippery molecule, meaning it enters all your cell membranes, even into our tiny little mitochondria, those mighty little things, the powerhouses in every cell, and it gets into your brain cells. So without Q, we're going to run into a little bit of trouble making energy, making ATP. ATP provides the energy to facilitate blood sugar regulation, muscle contraction, disease prevention, brain health, memory, heart function, angina, arrhythmias, high blood pressure, shortness of breath, heart palpitation can all ensue if coenzyme is lacking. So there are so many multiple studies in the heart function area of coenzyme. And literally, because this is everywhere, this cofactor is ubiquitous. And so its other name is actually ubiquinone, because quite literally it is found in all plant and animal cells. And that might just indicate how brilliantly important this coenzyme is for us. Now, some of the things that will help make it decline are age. We do produce less of it as we age, but also drugs. And now, the very drugs that we use to treat heart conditions, unfortunately, can have an impact on this cofactor that could help the heart function. So most importantly is statins. We've all heard of a statin, atorvastatin or simvastatin or a pravastatin. Now these are there because they shown to be really effective in people who have had a big heart attack or congestive heart failure. And so we use them quite a lot. Now, everything about the statin is dose dependent. So, you know, a low dose may not have such an impact, but a really high dose may have an impact. So we need to be conscious and cautious when we're looking at these and what we need in terms of supporting them. But what happens is, you know, cholesterol, I'm going to just show you the energy production there. Cholesterol synthesis, this is probably the most complicated slide we'll get. It works by stopping this enzyme here, this HMG coenzyme A reductase. And when it stops that, it stops the production of the cholesterol, which is what we want, because we don't want it to block up any more arteries or anything else. But as you can see down the bottom here, it also, in that same pathway, is coenzyme Q10. So they work by interfering in this body's natural metabolic pathway. So they competitively block that enzyme on the top there, particularly in the liver. So as that's blocked, we dramatically slow down cholesterol production. And in a disease state, that's exactly what we do want. That's what we want to happen. Now, coenzyme Q10 does rely on this same pathway to be able to be produced endogenously in the body. So it seems likely then, just from that, that statins are likely to reduce the amount of Q10 in the body. Like I said, dose dependent. Also, other things to take into consideration is your age, diet, previous health history, any other comorbidities. So not everybody will get depletion to a high level at all, and some people may get a lot of depletion. So now we know that Q10 is really important for muscle contraction and muscle health. And muscles need energy. Heart muscle needs energy. And my worry is that we take away some of that energy. And so now, if I look at the common side effects of a statin in the BNFs, I'll find arthralgia, joint pain, asthenia, which is sort of an abnormal physical weakness or a lack of energy, muscle complaints, constipation or diarrhea, GI discomfort, sometimes memory loss. Rarely it says myopathy, which is a muscle disease, and sometimes diabetes in those risk. So we are using a lot of these drugs in this country, and we can support the body while we're on them. So that's the key message here, is that Q10 could dramatically reduce the side effects you may get from a statin cholesterol drug, but it could also at the same time protect your brain, your liver, and your heart as well. So there's a really good marriage to be made here, I think. But again, let's personalize that to you if it's what you need. Very quickly, I'm going to just talk about glutathione. Glutathione is what we call the master antioxidant. It's really important. Your liver loves it, and I absolutely love my liver. It's the most underrated organ. It just does masses of stuff for you. It's unbelievable. So I call it the delightful liver, because it's the great master of detoxification. It can literally do anything for you. Whatever you put into your body, whatever you desire, your liver sorts it out for you and gets rid of it. Toxins, drugs, it filters everything. So it's a really important organ. But glutathione helps the liver do its job brilliantly. So we need it. We need loads of it. Your liver does literally need loads of it. So your liver's got to break down every meal you have, every single thing you're going to eat, and it's going to need loads of energy to do that. Now, your body doesn't really store glutathione. It kind of makes it as it needs it. And you can use up your body's stores of glutathione just for eating, never mind anything else from a lifestyle perspective that you might decide to throw in there too, like a little excessive alcohol or other drugs, or a mass meal. It puts work on the body to deal with it. So the glutathione, it sweeps up all the dangerous free radicals around the body, protecting it. So through all the systems, it helps prevent tissue damage. It boosts the immune system, reduces risk for some cancers, indirectly helps joints and cartilage stay healthy. So it's really important. And from an environmental medicine perspective as well, it really helps the body's natural ability to remove chemicals and toxins, pesticides, cleaning solvents, by transforming them in the body so they can easily be excreted. So it's a multifunctional molecule with diverse effects in the body. And the reason why I really mention it here is because although I've gone through its effects, is overburdening the liver might cause problems. Now, the nation's favorite painkiller, anti-fever medicine is paracetamol. And in the UK, we, believe it or not, an estimated 6,300 tons of paracetamol is sold annually. Those little white tablets, 6,300 tons of it every year. And I think when you break this down per person, it's around 70 tablets per person. Now, this increases with age, how many doses you use. And really, in people over the age of 75, there can be more than 90 daily dose units per year. That's a lot. So we know we can take 8 paracetamol in a day. Now, in an overworked liver, you could just go up to 12, and that could become toxic for you. The reason being that when paracetamol is broken down, it makes this tiny little toxic, a tiny amount of a toxic compound before it gets excreted very efficiently by your liver and glutathione. Now, if your liver hasn't got enough glutathione, that can build up. When that builds up, it depletes the glutathione. Then the liver doesn't get rid of it, and then we start having problems with our liver cells, particularly attack the liver cells. So just a little caution, don't overdo it. Be careful. If you're having a bit of a boozy night, you might not want to be taking, 4 doses of paracetamol the next day. Okay, so I know we're running out of time, and I never even finished my person's story. So that person's story, what was going on with him? I'm going to run through this quick. These are the drugs he's on: a beta blocker. He's on an ACE inhibitor. These are both for heart. Aspirin, an antiplatelet. Proton pump inhibitor, our favorite, omeprazole. Benraflumetazide, a diuretic. Cholesterol-lowering drugs, simvastatin, metformin. Now, what's the side effects? How was he feeling? He was tired. He wasn't sleeping well. Headachy, getting constipated. He had all of these symptoms. Muscle complaints, the joint pain, diarrhea. Now, if we really broke it down and looked at it, we could see what could possibly be going on here. Beta blockers like bisoprolol also produce coenzyme Q10, as well as melatonin, our sleep chemical. Lisinopril is going to have an impact on magnesium, calcium. Again, we know the downstream effects of that on things like vitamin D as well. Aspirin, long-term use of aspirin, iron, vitamin C. Proton pump inhibitors, we know they pretty much affect everything. And the diuretics, electrolyte imbalances potentially. Might be losing the magnesium, as we found with furosemide earlier. We're pushing more out, but we're absorbing less because we've got things like metformin and omeprazole in our stomach. So you can see now a lot of these things here. We have a working hypothesis here. We could help this gentleman to tolerate his medicine better. What I might pick out of this is some B12 and a B complex, maybe some coenzyme Q10, maybe some magnesium. But again, maybe that's it. But that could make all the difference to make these side effects slowly dissolve away. So quality of life is not compromised. You can continue taking the medicines and look after that heart and continue to enjoy life too. So when we come to these supplements, if only I found him earlier. Back before it's too late. Sensible supplementation. Can you get it from your diet? Are you at risk of deficiency? We're going to look at the whole picture because it's based on a personalized approach. And we know how broad and powerful micronutrients are. So this is my simple guide to integrating new supplements. One supplement at a time. When you're thinking about dosage, start low and go slow. Be aware how your body reacts. This awareness. Said it many times, I'm going to make you more aware, but you need to be more aware of your body too. How does it respond? How does it respond to that dose of magnesium I just gave you? Does it go higher, or do we come lower? And when do we want to add in the next nutrient? After 1 week or 2 weeks? This probably sounds sensible. How long do we want to take them for? Indefinitely? I'm not very keen on indefinitely. I like there to be a little time frame. And also, with that, we know where you can be by monitoring and testing to see how you're getting on with things. So I think that's the other important part of it. Test, don't guess, especially when you're on multiple drugs. When you're on the merry-go-round and you want to come off the merry-go-round, let's help you do that. As a collaborative team, I think that's what we can do for you. We can go into the depths, look at some of the routes, and hopefully give you that vitality to enjoy life, letting those nutrients give you that joie de vivre that makes us all so happy. Awareness empowers action. Remember how important medicines are. They can save lives, but nutrients sustain life. Supplements can help. Monitoring and testing can keep you safe. But I think I just managed to get that all in before 8 o'clock. So I hope I didn't go too fast for you. There was a lot of information there, but this could very easily have a part 2 and a part 3 because there is so much depth to this. And I think there is so much we could all learn from it. And the more we share with others, the more awareness we can bring to others to be mindful of all of these things we've spoken about. So I would love to invite Indra back and also ask you guys for any questions or thoughts. I would love to hear anything from anyone. Thank you so much.
Thank you so much, Bobby. That was so interesting. And I've written some notes down for some of the patients that that we're working together with. Just before we finish and before we go on, if anybody needs to leave, I just want to tell you about our next webinar, and then we'll take the questions that if you can just stop your share, Bobby.
Yep.
Oh. So just before, if anybody needs to leave, because it's already 8 o'clock, this is our next webinar, which we are doing with our endocrinologist, Dr. Natasha Patel. She's doing a thyroid talk on the 26th of June. And I've put in a little questionnaire for everybody to fill in as well, if they want to tell us a little bit more, give us a bit of feedback, and want to just stay connected with us with our newsletter to know when the next coming up. You will be able to find it on our website. We also now have an online booking facility. So if anybody is wanting or has thought, oh my gosh, I need to look at my medication and maybe have a bit of a medication review, we have the ability to book with Bobby now online. And if you go to our website and have a look at individual appointments, you'll be able to book directly on there as well. So, and we also have our booking for a complimentary discovery call if you want to come and see us. So thank you so much, everybody. We've got a few little questions here. KF, how would you have recommended supplements, or would you try changes in the diet first using this case study in the presentation example?
Yeah, diet is always first, in my opinion. I suppose it depends at what point in this journey this gentleman has come. How soon after being on these medicines has he come? So the sooner he's come, let's say he's had a major heart attack, I would probably in the first instance just want to be looking at the diet and balancing that with all the drugs, because there's a lot going on with the body. So getting the diet balanced in first, and then actually considering adding in the other things. These depletions can take time, so they're not going to happen overnight. So you don't have to jump into them straight away. We've got time to work with them and get the things correct first. But as a rule for me, diet first and then add them in.
Excellent. I hope that answers your question, Kirsty. Gemma says, thank you so much for so interesting. My mum is on metformin and she's been told she's very low in folate. So this is making a lot of sense. So thank you very much. Michelle is saying, would you suggest that women on the contraceptive pill take a B supplement?
I think it could be very helpful. Yes, long-term contraceptive pill and a B supplement could be really helpful. Yes.
Does Corrie want to jump in at all?
Hi everyone. Yeah, so obviously we always look at health on an individual basis. So it's looking at your diet currently and what you could do to improve that. I think it's also important, and Bobby will probably agree with me, is that the quality of supplements varies hugely, and it's really important that you possibly get some advice on that, or you look into that well yourself, because the raw ingredients of that supplement can differ, and also the way that they then act in the body can vary. So that's important when we're talking about supplements as well.
Yeah, absolutely agree. Absolutely agree. Getting the right form for you as well, because there may be medicines you're on, then your stomach can't actually absorb them. So we might need to use a different form, which is absorbed, let's say, through the buccal cavity or in a different way. So it is really important to personalize that to you.
That's amazing. So does anybody else have any questions there, please feel free to unmute yourself and ask any questions. If not, we are at 2 minutes past 8. Oh, just here, there's one more coming up. Judy Brunette, I have a liver disease, autoimmune hepatitis, and hepatologists say I should avoid all supplements except calcium and vitamin D. Meds are cortisone and immunosuppressants. What can I use? Judy, obviously you know that we can't, we can give direct medical advice, but I'm sure that Bobby will be able to talk a little bit about that. Bobby, do you want to take that?
Sorry, it blipped out for a moment, but I think that would be, it's quite direct medical advice. And I think we would need to look at all the details of the drugs and how long and what's going on with the liver before we would think about it. In terms of avoiding all supplements, I think it's very easy to say that in many facets of the medical world, but I think it needs a bespoke look at.
Thank you so much, Bobby. Other than the supplements already on the market, are there any that you can advise a pregnant woman to take? I would put that to Corrie and to Bobby. Oh, and we've got a question from Janine as well there.
Well, I think it depends. Interestingly, last week I was talking to a nurse I work with who got really sick taking pregnant care, which is probably the most common one that you're going to buy over the counter. And actually, with a bit of research and discussion with colleagues, she actually found she'd started to take them separately, but in the sort of amounts that were in pregnant care, and could take them at different times during the day. And actually, it completely resolved. I mean, she was having that hyperemesis gravidarum, where she was literally having injections of ondansetron, which were making her really ill. But actually changing the way she was taking the supplement made a big difference. So again, I think it depends on how you're feeling with what's out there. But pregnant care is probably the most common one, but it may not be the one for everyone. Anything to add, Corey?
Yeah, I mean, that just backs up what I was saying about looking into the ingredients in different supplements and the quality. So, in pregnancy, it can be very helpful to take a multivitamin. But again, there's very many multivitamins out there for pregnancy. And some forms of iron can cause more constipation than others. And in pregnancy, that can be a problem. So there's different ones that I would suggest for different people. And also, so some supplements aren't suitable for in pregnancy, but sometimes there can be times when a specific supplement can be helpful because of specific presentation in pregnancy. So I wasn't sure exactly what your question was asking, but yes, different supplements, not necessarily always advertised as for pregnancy, can be taken in pregnancy, but obviously you have to act with caution and make sure you know how they act in the body and what they're doing.
Thank you, Corrie. Janine, do you want to unmute yourself and ask your question?
Yes, thank you. Evening, everyone. I just have a question regarding the pancreas. So my son was diagnosed with cystic fibrosis, and this affects his pancreas, and he has to take enzymes to substitute for that. So I just wanted to know if it is possible for us to reverse this with taking the correct medication and him eating the correct food for his condition, his age, his body weight.
Thank you, Janine. I think when it comes to something like cystic fibrosis, there is it's a whole system issue. And I think when we're looking at it from a functional medicine perspective, we're wanting to optimize health as opposed to necessarily reverse anything. Personally, I haven't had any experience with that in terms of how we would be able to reverse or just improve health and well-being, because I think there's a genetic component to this as well in terms of how the body is reacting. So when we are dealing with any conditions that has a genetic component to it, what we're doing is to making sure all the basics of how the body is working is as optimal as possible. Things like your gut health and stress levels and nutrient content, vitamin D, all of these things, is everything as optimal as it can be to just make sure that we're reaching the optimal that person can achieve. So I'm not sure of any studies as well directly, but I can definitely have a look for you. But as long as we're optimizing everything that person needs for their body to work effectively, that's what we can do from a functional medicine perspective. Let's have a look. There's one here from Gemma. If the medication is stopping or preventing absorption, then would this be managed? Would it be a bespoke look individually, as my mum has been given folate and sent on her way, and doctor did not correlate the deficiency with the long-term use of metformin? Bobby.
So I think, unfortunately, a lot of these deficiencies don't get correlated necessarily with the drug. But these are things that we've started to understand a lot more on. So we can look at the research papers on it as well and sort of provide that evidence sometimes for the doctor, which can be really helpful. But you may get the folate, but we may also want to know, is that folate absorbable with that medicine? So what form is that folate in it as well? So, you know, you could have a methyl folate, and that methylation of the folate makes it better absorbed and actually more beneficial for the body. I think the folic acid that we often use on prescriptions here, which is a high dose 5 milligram, is a synthetic version, and it's a little bit not as easy to be absorbed into the body, especially when you have got this problem in absorbing it anyway. So again, I do think a bespoke look would be beneficial, because then we could figure out really what would be the right route and form of folate.
Thank you so much. One more question. There's a supplement or natural intervention to manage high cholesterol, especially LDL, except simvastatin. Oh, that's a big question.
It's a really big question, and I think it depends again on what has happened and at what point you've been diagnosed and given simvastatin and at what dose. So there's a lot of factors there that really need to be looked at. So there's definitely not one blanket answer to that. There are lots of natural things around that can help to modulate or normalize cholesterol in a certain way, but whether it's right for you to replace simvastatin with it is another bigger question.
And I think the other thing with the cholesterol is that what we're starting to learn in functional medicine is that is low cholesterol actually healthy? Now that's a whole other conversation, because we're now, I mean, we had a case a few years ago of a young chap who had quite low cholesterol, and actually what we found out is that low cholesterol can actually affect your mental health. And he had suicidal ideation because, well, we don't know whether it's a because, but there was an association with his low cholesterol. We started improving his cholesterol, his digestion, his absorption of fat, and his mood and everything improved with it. So in functional medicine, we use sort of different testing to look at the kind of cholesterol that you have. So the other thing that we have in conventional medicine is that it's cholesterol or not cholesterol. Here we've got big fluffy cholesterol and hard dense cholesterol. And some of the testing will allow us to know whether the kind of cholesterol that the person is experiencing is good for them or not so great for them. So it's, again, not a blanket answer, but making sure that for your cholesterol, making sure that you have got everything to make it properly, and also asking the question, why is your cholesterol raised? Because cholesterol is actually really protective. It's an anti-inflammatory, it's an antioxidant, and it also is the pathways to producing all your hormones. So you need your cholesterol to produce your cortisol, you need your cholesterol to produce your estrogen, your testosterone, your DHEA. So it's not a simple answer, but it's about understanding the overall picture as to why. And that's why I love looking at functional medicine, looking at through the lens of functional medicine is let's go upstream, understand why this is happening. And then it may be that there are things out there like red yeast rice, but in the end, I was speaking to a cardiologist about red yeast rice, and he said it is exactly the same as simvastatin. It is working in the same pathway. But if you want somebody to bring the cholesterol down, you want a regulated medication that's giving you the right dose at the right time consistently, as opposed to supplements which may not be giving you the right dose consistently. Does that make sense? Amazing. Sati. Please, yeah.
Oh, hello. Yeah, I've just unmuted myself. I just wanted to say that was an excellent talk, Bobby. It was very informative and lots of things that I would just love to follow up on. But I'm not going to, because lots of people are asking detailed questions. And I think what I would like to know from Bobby, from yourself, Indra, is this is so wonderful what you're doing, this functional disciplinary team that you have. I know, Bobby, you're saying be empowered, go and talk to your doctor, but I feel there's more empowerment to talk to a group like you and what you, because you have, each of you have a different skill set, a complementary skill set. And I find it a shame that I kind of almost know that if I go and talk to the doctor about some of the things that have come up today, I just already know it's going to be time's up. Do you know what I mean? So what I would love to know, Indra or Bobby, if you can just outline it, because I'm sure many of the people on this Zoom call would like to know as well, some people with some very serious questions that they would like answered, is how does it work? Like, how would it work to have this kind of session with 3 different people with complementary skill sets? How do you share the information? And how do you help the patient in that way holistically?
Thank you so much, Sati, for that question. We've put these webinars on to share information because we realize that there's a lack of information in certain areas, and really to showcase the fact that we are a collaborative care team. And what we do in our practice is that we're all under one roof. And every week on a Monday, we all get together and we discuss the people that we are looking after. We bring them to the table. We understand what each of us is seeing in that patient. So our programs of care are kind of a collaborative program. You will see a doctor, you will see a nutritional therapist, you will see one of our coaches, and you'll see, and then we will decide on testing together, and then we'll put your plan together. So it's a very holistic look at the whole thing. It's quite an intensive process. And I think if you're ready for it, it's very enlightening. You get such, big aha moments with people. I mean, some of the people that Bobby has seen with like complex medications, they've been like, I didn't even know that I should be taking this at this time and this at this time. So that's how we work together. And we realize that some people are not ready for the whole thing. So we have now sort of brought in individual appointments. So you may be ready to have a medication review. Come and see Bobby. He will explain how the rest of us work. He will bring you to our table and say, look, this person has got this. What else can we do for this? So that's how we kind of work. Hope that answers your question. But
yes, it does. Thank you, Indra. Excellent. Thank you.
Thank you, Sati.
Excellent. Thank you very much, everybody. And I hope that's all been really informative. And I think there's another one here about minerals and vitamins that do not dilute the effect of immunosuppressants. What we can do, Judy, is just give us a call about that, or we can organize a discovery call and we can maybe talk through what you're needing as well for yourself. So if there's no other questions, because we've gone over by 15 minutes, I want to say a very big thank you to everybody. If you are able to fill in that little questionnaire so that we can find out more about what you're all wanting, that would be amazing. I'll just pop that back onto the link here as well. And make sure you do sign up for our newsletter as well. And if there's any last thoughts, please let me know, Bobby.
No, I don't think I do, other than a massive thank you to you all for joining and for listening. And, and a massive thank you to Indra for this team that she's got around her, because it's a joy to be part of. So thank you all.
Thank you so much, everyone. Take care.
Thanks. Good night.
Good night.